Okay, so can you give just a brief overview of ArthritisPower?
Sure. So ArthritisPower is a free patient-centered research registry. It's for people living with joint, bone, and inflammatory skin conditions. Patients can select from dozens of symptoms to track, ranging from pain, fatigue, physical function, and more. And they can share that data directly with their doctor. This is important because many patients go between 3 to 6 months. The patients that we see go between 3 and 6 months to their doctor's office. So that data that's saved in ArthritisPower, along with any notes that they take, and they can take notes within the application itself, it can improve that communication between the doctors and the patient visit.
And what prompted the creation of ArthritisPower Español?
Definitely. So historically, it's hard for Spanish-speaking communities to find any type of application or any sort of health education that is based on science and in fact. They unfortunately, especially in the Hispanic community, it's plagued with misinformation. Just a very anecdotal type of data point that we've seen is all of the arthritis content on Facebook. 90% of it is misinformation compared to 10% where it's fact-based groups that are sharing proper information about arthritis, and especially rheumatoid arthritis or rheumatoid conditions. So it's quite alarming, and that, along with the pandemic, really motivated us to create as much opportunities and tools for our community as possible.
So I think you just kind of touched on this in a way, but definitely want to explore this further. How are Hispanic patients disproportionately affected by joint, bone, and inflammatory skin conditions?
Right. So based on the research that we've done, Hispanic patients are nearly twice as likely to become disabled from arthritis and experience joint damage. That doesn't mean that it's more prevalent in the Hispanic community. It simply means that they're diagnosed at a much later stage in their condition, and the reason for that is also strictly related to the misinformation out there, right? So they don't know the difference, even the difference between osteoarthritis and rheumatoid arthritis, that arthritis entails hundreds of different diseases, what type of specialist to go see once you believe that you're experiencing symptoms that might be a certain condition. All of these things are not easily available to our community, to the Hispanic community. Therefore, it is quite obvious whenever you start seeing these types of stats where they're twice as likely to be disabled from a condition that can be treated, and you can have a good quality of life as long as you're treating it the accurate way.
And what influence, if any, did the COVID-19 pandemic have on the creation of ArthritisPower Español?
So that rampant misinformation just kind of blew up. It multiplied exponentially during the pandemic, and that really motivated us quite heavily to create these types of tools for our community.
How will this help rheumatologists forge a better relationship with their patients?
A proactive patient is an adherent and motivated patient. The better communication a patient has with a rheumatologist, the better off their outcomes will be. Therefore, this tool, ArthritisPower Español, aims to do that.
And are there any last comments or thoughts that you want to share that we haven't gotten to cover?
I'd like to invite everyone watching or listening to this to refer their patients to CreakyJoints Español for the links to ArthritisPower Español and to articles about different articles about treating their condition, It's cjes.org. And the direct link to ArthritisPower Español is arthritispower.org.es.